Hi, I'm Dr. Ben Lerner.
And I'm Dr. Eric Lerner. You know, maybe one of the most common symptoms or health issues we see in society today is people suffering with headaches, whether it's migraine headaches, tension headaches, just headaches in general.
Yeah, you know, what's interesting is people come into our clinic all the time with headaches. I mean, almost everybody, it seems. And I'll tell them, you know, I've never had a headache.
I had a woman recently who didn't believe that headaches were something that anybody didn't have. She said, no, everybody has headaches, but I've actually never had a headache either.
No, and so they're common, but they're not normal.
Right.
And in fact, I always tell them, if one of our patients has a headache, we look for what's wrong. So it's not a normal condition. There's something wrong that's gone on in your body causing the headache. And that really gets into the crux of what we do. In fact, when it comes to headaches, even whether it's the Harvard Journal, the Journal of American Medical Association, WebMD, Spine Magazine, British Medical Journal, all of these journals have shown articles and research proving that if you can correct the problems that are going on in the neck, you can get rid of your headaches.
Yeah, I think I saw an article once that it was literally saying like 98% of headaches are caused by an issue in the upper part of people's necks. I think most people, though, when they get headaches, again, the mistake that they make is they're just taking drugs for them. So they're taking, whether it's Tylenol, Advil, aspirin, and if you talk to any of those people, if you're one of them, it's never that the headache goes away completely. They might feel a little better when they take the drug, but it always comes back because they aren't suffering the headache because of a lack of Tylenol.
Yeah, there used to be that commercial, Excedrin PM for your normal, everyday evening headache. And I can tell you they're not normal and they shouldn't be there every day. And if they are, it's something to look into. Another thing I point out a lot of the times is somebody says, well, I just get one a week or twice a month. Well, one a week is 52 headaches a year. Twice a month is 24 headaches a year. And people are probably minimizing that fact. And if there's even any sort of regular headache, we should be looking at what is going wrong in your body, because the problem in your upper cervical spine, not only is it causing headaches, that's a warning that something's really going on in your body that needs to be looked into.
Yeah, so we had a young guy come in. He was 20 years old. He'd been getting these headaches, migraine headaches, since he was 5. So imagine a 5-year-old getting migraine headaches. His parents had taken him to the pediatricians. He had been to neurologists, all sorts of headache specialists, and for 15 years was taking medication every single day, to the point where by the time I met him, he was actually doing that self-injectable thing into his leg. And we took an x-ray, looked at his neck. Sure enough, big time issue right in the mid to upper part of his neck. We started addressing that, which was actually why he was getting the headaches. We started addressing that cause. And I would say within the first 2 weeks, we had him off the medications and headaches diminishing, and within maybe about a month, headaches completely gone. So it was as simple as looking for the answer, fixing it, and no more drugs.
And we always say chiropractic isn't a treatment for sickness, pain, or disease. It's about getting to causes so your body can be well. But headaches certainly are one of those problems that really does incredibly well with chiropractic. So if you're suffering from headaches, it's as simple as just checking your neck out to see what's causing it and making sure you've gotten rid of causes and you're not just out there covering it up with medication.